In this video, we're going to talk about getting a patient who's had back surgery or has back pain, maybe a lumbar fracture, maybe abdominal surgery, how we get them up and going. We're going to go ahead and also don and doff a hard shell brace, a TLSO, thoracic lumbar sacral orthosis. So we'll go ahead and get that started. If you do have to don and doff one of these, you almost always need a helper. You almost always need two people. You want to be sure that you examine the brace first and know which is the back and which is the front and which is top and which is bottom, so that you only have to do this once, hopefully. So we're going to go ahead and ask Vic to roll so we can get his brace on. Remember, for our back patients, when we have them move in bed, the main principles are never have them lift or move both legs simultaneously, and that as they roll, their shoulders and their hips or pelvis should move at the same time in one piece. Whether or not you have the guardrail up when they roll is kind of up to you as the clinician. I like to have it down because at home they're not going to have it to help, but some people do let them have the guardrail up so they can help pull themselves over. We'll elect to keep it down. Okay, Vic, I'd like you to bend this leg, plant your foot, good, and now this one, very good. Okay, you are going to roll over towards Chris. So reach over with your arm on 3 in one piece, hips and shoulders at the same time. You're going to roll over this direction. Go ahead, Chris, you can do the count.
1, 2, 3.
Good. We're going to get the patient all the way over and possibly even a little past neutral, so we can try and get this brace in where it should be. I'm going to try and slide this or hook this underneath him. I want the narrowest part of the brace here, right above his iliac crest and his waist. So we'll do our best. It's sometimes not easy. It's especially not easy when the patient's got street clothes on, so that's going to be my excuse if we don't get it. Just trying to make sure I have his t-shirt pinched in there. So I'm going to get that underneath him as best as possible. Okay, good. And go ahead and roll over. Again, shoulders and hips together, and whoo, pretty good. Actually, I almost overcompensated. Okay. Now we put the top piece on. That top piece always goes on the outside. And then usually you secure the straps two people simultaneously. So I'll wait for Chris to get his. I usually start in the middle. We tighten about halfway. And then I work up and down from there. At the bottom. And at this point, you can double check and just make sure that the brace is on correctly as far as up and down, left and right. Looks pretty good. So now we're going to come back and do the straps again and do them tighter. Okay, good. Now we're ready to help the patient get up and out of bed. This time, just for fun, we'll have you roll this way. Okay? So, again, you can reach with your arms, but your hips and your shoulders come all in one piece. Go ahead and look that direction. 1, 2, 3. Good. Okay. Now from here, I'm going to have you bring your knees towards your chest just so your ankles are near the edge. Good. Okay. On 3, you're going to drop your ankles and push yourself up with your arms. Okay? We're going to try and sit up one piece. Ready? Okay. 1, 2, 3. Excellent. Excellent. Good. Okay. And then from here, it's just the normal scooting and standing. To get back down, obviously it's the same idea in reverse. So we're going to go down to this side. This arm comes across. But as your shoulders go down, your feet come up. Nice and slow, perfect. And roll back over, one piece. Good, we'll go ahead and take the brace off. And because you are closer to that edge of the bed, I'm going to have you roll towards me and you can pull the brace out, okay? And just for demonstration purposes, let's try it with the thing up. I don't like it, but go ahead and roll towards me, all in one piece. 1, 2, 3. There we go. I'm going to pull this out from underneath. Perfect. And roll back, all in one piece. Okay, you can lower one leg, lower one, and then the other. Perfect. Okay. It's a little cattywampus. If we want him to straighten out in bed, depends on his precautions, whether he can bridge or not. He can probably just, let's move this leg this way and this one this way. Now you feel straight? Okay. Okay, good.